You touched on, I think, eczema and psoriasis, but you know, we see a lot of commercials for certain products and on TV. What can be helped, or what can be done to help those conditions naturally?
Naturally, well, I guess let's take one at a time because they have a different etiology. But
Okay.
For both of them, for all of this, the diet's very important. In eczema, a lot of food sensitivities and food allergens can be flaring up the eczema. So you have to kind of go back to square one and do a food diary and try to figure out if there's some foods that seem to be flaring up your eczema. And a food sensitivity, though, can be delayed 24 to 48 hours. So it is very, it's difficult, you know, or you could go the other way and take out one thing like that's a common allergen, like corn or dairy or wheat, and see if that makes a big improvement. That might be an easier way to, you know, just go with some of the common allergens and see if that helps. And the eczema also is very calmed with the omega-3 fatty acids, the evening primrose oil, orally and then topically. Very calming, very anti-inflammatory, and very soothing. So that's also excellent for that.
Okay. And then psoriasis?
Psoriasis, there's been many things tried, and actually for eczema too, a lot of herbs and a lot I reference in my book, many different treatments. But psoriasis, it has been shown, also diet's important, but it's felt that maybe a more limited protein intake is good for psoriasis. There's been studies to suggest that. Also a very alkaline diet with a pH about 7.4, something like that, because the acidic diet, it's not good for your body in general, but especially flares psoriasis. And there's been studies that have shown that the vitamin D is actually linked, granted a study in 2003 that linked vitamin D to how well your psoriasis does. And also eating a lot of tomatoes and carrots, they've shown with the beta-carotenes, higher in beta-carotene, better psoriasis. All these anti-inflammatory vitamins, A, beta-carotene, you know, B, all the Bs, especially folic acid, C, D, and E, all shown to help people with psoriasis.